So at Crusader, we do a variety of procedures here, and I actually have had the opportunity to work both with the adult patients and the pediatric patients. When we're not dealing with the COVID-19 pandemic, I'm usually in our school-based program, and we see high school students and students from the surrounding Rockford area who get bused in, and we do all their dental treatment there, which is really cool. It's a great point of access to care. My name is Isabella Newcomer, and I'm a general dentist at Crusader Community Health. So both my parents worked in the healthcare field. My mom's a nurse and my dad's actually a dentist. So I knew I wanted to do something healthcare related, but I wasn't exactly sure what I wanted to do. And then when I got to high school, we were able to go on a dental medical mission trip as a family, which was a really great opportunity. And it just made me really focus in on dentistry. The other kind of cool thing about dentistry is, besides it being very medically minded, you also get to do a lot with your hands, as I'm talking with my hands, and basically with the arts to make people look a certain way, so that when someone maybe loses part of a tooth on the front of their mouth, you can make something that looks real, so they can smile again, which is really cool. So in order to be a dentist, there's a variety of ways you can get here, but generally people go to a 4-year college and get a degree in something and get all their prerequisite classes done. I studied biology at a 4-year institution and knew I wanted to go into dentistry. I actually took a year off between college and dental school and worked as a research intern at another university, which was a great opportunity because then I could use that research knowledge with my patients in dental school and even beyond dental school, which has been pretty cool. But dental school is a 4-year program after a 4-year college program. Generally, we have a variety of procedures throughout the day. So some of it is limited examinations. Patient comes in with a chief complaint of pain on the top right side. We take a diagnostic image, take a look inside the mouth, see what's going on. Sometimes it's something really easy, oh, we can just put a filling in here and then get them on their way. Sometimes it's taking a tooth out, and that's usually a little bit more involved, and you want to give them more information for aftercare. That's generally with the adult patients. With our pediatric patients, again, might come in just for a normal examination, cleaning, kind of like we do in our school-based clinics. And then if they need more treatment, just having them back to do a little bit of fillings, sometimes taking teeth out. With the kids, it's a lot more distraction, finding ways to make dentistry fun. One of the best things about my career is that I get to work with all ages and people coming from all basically veins of life. So I get to work with the really, really, really little kids when they're coming in for their first dental experience and making it so it's not something super scary, just like, oh, look, we're gonna count your teeth, this will be a fun time. And then on the opposite side, you might, what I think is a lot of fun is working with somebody who maybe has not had the best dental experiences in the past and finding ways to get them comfortable with you to do what they need to do to get back to health. So there are a couple different routes you can take in the dental career field. Dental hygienist is a route that some people take. That usually requires a 2-year degree after the person has also done some introductory science classes, things to kind of get into the pathway, and then some on-the-job training after graduation. And they do a lot more with dental education, working with the patients right when they come in and getting them prepared for their day-to-day things with their mouth. For dentistry, as we were discussing before, doing the 4 years of college and then 4 years of dental school, and then if you want to specialize even further besides just general dentistry, that can be 2 to 5 more years after getting into another program. For if someone's interested in doing braces or working just with kids or only taking teeth out and doing facial reconstructions. In order to be successful in a dental career, the skills that really come in handy are effective communication, compassion for others, and ability to kind of think on your feet and find ways to make things work where it may not be what you expect, may not be what you planned for. I would say for a high school student who is interested in a career in dentistry or anything in the healthcare field is if you have the opportunity to volunteer and do some shadowing hours just so you really get an idea of what's going on in the day-to-day, because some things may not be what you expect and it just gives you a good idea for moving forward. Also, in dentistry and a lot of the healthcare careers, really kind of buckling down with your educational side of things just to get prepared. There's a lot of science and medical terminology that comes into dentistry and anything in the medical field.